they are ready. We can have a few questions. You need questions? Dr. Chamla, you were talking about
sorry, I don't have a question actually. Thank you for all the presentation. I have a comment. I'm a senior physician in family medicine. Wherever there are consultant family physicians, they are trying to establish this home-based geriatric care in Sri Lanka, and especially in Dabadeniya, Katogassala and Jaffna. There are well-established home-based geriatric care going on, especially in Jaffna, where there is a dedicated geriatric helpline where people can call and get telemedicine services, plus they will be registered and later home visit will be paid to their houses. And we do caregiver assessment in physical and psychological both when we go there. And I think it's a good model for a low resource country like us. But we still have a lot to learn from Malaysia. I think the idea of the virtual ward, I think we can establish it with some help from our geriatricians. Thank you.
Thank you very much.
Thank you very much for your comment. I mean, I think, as Dr. Jamila has also pointed out, there's a lot of partnerships, especially amongst geriatricians, tertiary centers, and primary care. And I think what we find in my country, the primary care physicians are under-resourced and underused and under-engaged where aging services are concerned. So what we're trying to create is the community care geriatrics via our postgraduate diploma, etc., getting a lot more engagement there, and appointing primary care physicians in key locations around tertiary care for a start, and actually incorporating that visual ward and telemedicine with a primary care partner. And what we are trying to incorporate is getting the iCode model, where you're testing vision, hearing, falls risk, visual time, all the various model of using the iCode, so that then you actually are becoming more data driven and you create that iCode data, so that then you can actually bridge a lot of these care services across the region. And then that would be very, very, I feel, a good partnership that we could have across our Southeast Asian countries.
Telemedicine, the reference system, is it available in Sri Lanka if GPOs can have a telemedicine, a GP can refer doctor online? Are there, is it existing in Sri Lanka? The consultants and the GPs. Telemedicine?
I think the Sri Lanka Medical Association ran a very good telemedicine service during COVID time, and that model can actually continue. That was a wonderful system which helped a lot of patients, and our patients could directly contact the consultants. We were also just hanging around at homes, and it's a good suggestion. I think formalizing of the existing services which have trial tested and which have worked wonderfully, we can just continue them to provide support to the primary care physicians, and a very good initiative done by the family physicians. And like I mentioned, these are all very fragmented, and I'm guilty. I didn't know about the service which is happening in Jaffna. So it's likewise linking up all the services available for our geriatric patients will be a very good system reform to take about.
Just to add, madam, the telemedicine services in Jaffna and Katugaseta, we have WhatsApp group formed by the, like for example, consultant oncologists and the healthcare team. So whenever we have queries, we just have to put the message in WhatsApp, and whenever we send referrals, within few hours of the oncologist, when he sees the patient, within few hours we get the management plan.
Thank you. The palliative care services, especially in Kandy, it's well established.
To continue with what Dr. Milas mentioned, yesterday there was a presentation. I think that what would be more appropriate is telemedicine from primary care to tertiary care, more than from what would be more appropriate. There was a presentation, research paper also yesterday. What would be more appropriate would be to more than from patient to doctor, the primary health care to the tertiary care is what would be more appropriate. But I don't think at the moment that any of these are in existence in the government sector.
This is just a comment from what I gathered from Tamila's lecture and from Professor from Malaysia. Also mentioned about adult elderly person empowerment. I think we are not concentrating on that area. We only wait until the elderly person reaches most of the time a healthcare worker for some disease. You see, our population retires, unlike in Australia, either at 60 or 65 maximum, I think, both in the state and in the private sector. So we don't have a plan to prepare them for this old age while they are working. Maybe in the last 2 or 3 years of prior to retirement, because it has to be very country specific. So we kind of have to prepare them. It should be built into the, their work structure, whatever place, whether it's a bank or a university or any other state sector. It has to be built into their, normal system, so that when they retire, prior to their retirement, you prepare them for a healthy life. You are just jobless soon after you finish your work. You spend hours at home probably without doing much. So, how to remain healthy? Because until that time, you may be having a lot of socialization with your colleagues, and then your suddenly left at home, probably maybe with your spouse. So, how to make it more fruitful should be an area that we need to concentrate, and in a formal manner, right? Like maybe we should encourage them to go for a wearable, invest in what Dr. Professor Lekha Masam said about, this AI assisted wearable. So they monitor themselves. So they will know early if they are heading for, some kind of thing. I'm just throwing an idea. Thank you.
So thank you very much for on behalf of Sri Lanka Medical Association. I wish to thank Professor Shahul Kamarasamy and Professor Kamarasamy and Dr. Chandra Dadu for this excellent and insightful presentations on this important topic. Thank you.
Thank you very much. I want all the panel to stay on the stage for just one moment. So ladies and gentlemen, please join with me for congratulating and thanking the expert panel as well as the chairperson for an excellent session. So now is the time for the certificate of excellence is given now at the moment. I would like to cordially invite all the panelists to come forward onto the stage, and the certificate of appreciation will be given by Dr. Varsha D. Soisa. Madam, please do come forward. To Dr. Chamila Dalbadatu. Ladies and gentlemen, let's give a big round of applause.
Madam, excuse madam, please come for me. Right, okay.
And also
right.
to Professor Sanat Lekambasam. Madam, would you do the honor? Yes.
Right.
Now I would like to cordially invite Dr. Ananda Vijay Vikrama to hand out the certificate of appreciation to Professor Sharul Baya Kamarusame. Thank you once again for the expert panel as well as the chairpersons for coordinating during this session. Thank you very much.
Excuse madam. Sir.
So let's